OSH situation in the local and global levels. Learning objectives. Find and articulate awareness of the OSH situation, both local and international. Identify the problems, issues and challenges associated with OSH conditions in the country. Create a safe work environment, enhance productivity through safety. OSH situation in the local and global levels. Ensuring a safe and productive workplace. Local study. Safety and health at work in the Philippines. Occupational accidents and diseases cause human suffering and loss. Their economic cost is high, with some 2 million workers dying each year from work-related accidents and diseases. And the figure is on the increase in spite of efforts to make inroads. The Philippine government estimates that 2.2 million Filipino workers in medium and large enterprises enjoy effective occupational safety and health, OSH, protection and services. In other words, 17 of 18 persons in the nation's workforce of 38.8 million do not benefit from acceptable working conditions. Studies substantiate that OSH conditions in microfirms and the informal sector pose risks and hazards. The ILO Country Office for the Philippines, CO Manila, supports programs to promote a culture of safety and health that bring OSH services to those that need them the most. A range of government and non-government agencies are partners, with beneficiaries that include agrarian reform farmers, informal workers and trade unions and their members. The office works with constituents, governments, workers and employers, organizations to promote ratification of the Promotional Framework for Occupational Safety and Health Convention, 2006, number 187. Mindanao. Safety and health at work in the Philippines. Construction industry is one of the world's major industries which involve operations that can be risky, dangerous and unhealthy. Thus, this fact results to the top prioritization of safety, health, and well-being of workers. Included the level of awareness, level of knowledge and the level of compliance of the project engineers and the construction workers of the selected construction companies. This study also determined the linear relationship between the level of awareness and compliance of the mentioned respondents. According to Benvenido E. Ledesma, Dole Secretary, ensuring the protection and welfare of the public within and around the vicinity of any construction site, as well as the promotion of harmonious employer-employee relationships in the construction industry, must be taken into considerations in industry practices and applicable government requirements. In line with this, the researcher evaluated and assessed the implementation of the safety and health programs of contractors hired by the commercial institutions in Davao City, which is based on the existing Occupational Safety and Health Standards, OSHS, and safety and health programs of the contractors. Luzon. Safety and health at work in the Philippines. The study aims to assess the exposure levels to physical risk factors and the associated risk of musculoskeletal disorders among maintenance employees at a Catholic university situated in a prominent city in North Luzon. Utilizing the Workplace Ergonomic Risk Assessment Questionnaire, this research collected pertinent data within a descriptive research framework from 23 voluntary participants. The findings revealed a predominantly male demographic, aged between 30 and 40, with an average job tenure of 11 to 20 years. A prevalence of musculoskeletal disorders has surged in the past decade, becoming a global contributor to disability and other health complications. Respondents displayed a medium level of exposure to physical risk factors associated with musculoskeletal disorders. To mitigate future musculoskeletal issues among maintenance staff, it is recommended to institute regular monitoring and annual medical checkups. International. ILO Helpdesk, Business, Occupational Safety and Health. Every day, 6,300 people die as a result of occupational accidents or work-related diseases, more than 2.3 million deaths per year. 317 million accidents occur on the job annually, many of these resulting in extended absences from work. The human cost of this daily adversity is vast, and the economic burden of poor occupational safety and health practices is estimated at 4% of global gross domestic product each year. Many of these tragedies are avoidable through the implementation of sound prevention, inspection, and reporting practices. The ILO has adopted more than 40 standards specifically dealing with occupational safety and health, OSH, as well as over 40 codes of practice. Enterprises should apply to the greatest possible extent the principles embodied in these standards and codes of practice. Austria. Safety and health at work in the Austria. The directive obliges employers to have one or more workers to carry out activities related to the protection and prevention of occupational risks, irrespective of the number of employees in the company. This obligation has been transposed into Austrian law, which requires companies to employ or contract an occupational physician and a safety engineer if they have more than 50 employees. EU legislation also requires Austrian employers to be in possession of an assessment of the risks to safety and health at work. As demand for OH services increased, more organizations providing them were founded. Today there are 41 such organizations in Austria. Occupational medicine has been recognized by the Austrian Ministry of Health as a separate professional medical specialism, as it is in other European countries, and the Austrian Medical Association has taken the new specialism on board. The number of physicians who aim to specialize in occupational medicine and to work as full-time occupational physicians is steadily increasing. Africa. Safety and health at work in the Africa. Analysis of occupational disease and injury statistics from South African industry, derived from annual reports of the Compensation Fund, were conducted. The publicly available database of occupational disease and injury statistics from the South African general industry is unstructured, and the data are inconsistently reported. This data scarcity, symptomatic of an absence of a functional occupational disease surveillance system, complicates judgment making regarding the effectiveness of implemented risk reduction measures, enacted occupational health and safety regulations, and the status of worker physical health from exposure to workplace hazards. The preventive measure in exposure occupational health and safety regulations were enacted, with both employers and workers instituting various risk reduction measures. The analysis of available occupational disease and injury statistics, indicators of worker physical health, can be used to infer the effectiveness of risk reduction measures and regulations in preventing exposure. Europe. Safety and health at work in the Europe. Europe has always played a key role in the field of occupational health and safety, OHS, and can be considered the cradle of occupational health. The European policy framework has been set since the establishment of the European Union, but its strength lies in the enactment of the framework Directive on Occupational Health and Safety. Strong positive impact on the assessment and management of occupational risk factors, and has promoted the quick diffusion of common standards across Europe. A lot of implementation issues still remain to be addressed due to changes in the world of work, fragmentation, economic crisis, and, more generally, to the impact of globalization. Challenges associated with OSH both local and global levels. Ensuring a safe and productive workplace. Local challenges. Workers in the Philippines are confronted with a plethora of challenges regarding their labor rights and protections that significantly impact their livelihoods and well-being. From unjust wages to unsafe working conditions, many Filipino workers encounter discrimination and exploitation in their places of employment. This article delves into the critical issues that plague the working environment in the Philippines, while also exploring viable solutions to enhance labor conditions for Filipino workers. Global challenges. Global occupational health and safety, OHS, is strictly linked to the dynamics of economic globalization. As the global market is increasing, the gap between developed and underdeveloped countries, occupational diseases and injuries affect a vast number of workers worldwide. Global OHS issues also become local in developed countries due to many factors, including untrained migrant workers in the informal sector, construction, and agriculture. How can occupational safety and health be managed? Both local and global levels. Both local and global levels should apply these kinds of practices to maintain OSH in the workplace of their workers. The following are: policy, organizing, planning and implementation, evaluation, action for improvement, controlling the risks, accidents and investigations, multi-employer workspaces, deciding who can help employers with their duties, consulting workers, providing training and information, providing supervision, first aid, safety signs. Managing safety and health is an integral part of managing a business. Businesses need to do a risk assessment to find out about the hazards and risks in their workplaces, and put measures in place to effectively control them to ensure these hazards and risks cannot cause harm to workers. These guidelines were designed as a practical tool for assisting organizations, a company, operation, firm, undertaking, establishment, enterprise, institution or association, or part of it, whether incorporated or not, public or private, that has its own functions and administration, and competent institutions as a means of achieving continual improvement in occupational safety and health. OSH performance. The guidelines have been developed according to internationally agreed principles defined by the ILO's tripartite constituents. The practical recommendations of these guidelines are intended for use by all those who have responsibility for OSH management. Conclusion. The Philippine government estimates that 2.2 million Filipino workers in medium and large enterprises enjoy effective occupational safety and health, OSH, protection and services. The ILO Country Office for the Philippines, CO, Manila, supports programs to promote a culture of safety and health that bring OSH services to those that need them the most. Workers in the Philippines are confronted with a plethora of challenges regarding their labor rights and protections that significantly impact their livelihoods and well-being. From unjust wages to unsafe working conditions, many Filipino workers encounter discrimination and exploitation in their places of employment. Every day, 6,300 people die as a result of occupational accidents or work-related diseases, more than 2.3 million deaths per year. 317 million accidents occur on the job annually, many of these resulting in extended absences from work. The ILO has adopted more than 40 standards, specifically dealing with occupational safety and health (OSH), as well as over 40 codes of practice. Global occupational health and safety (OHS) is strictly linked to the dynamics of economic globalization. OHS is a set of regulations that are designed to ensure that all workers have safe working conditions. These regulations help protect both employers and employees from potential hazards in the workplace. Both local and global levels